I'm here to tell you right now that Medicare Advantage and Medicare are oftentimes, more often than not, the route to go over group coverage unless your drug costs with your group plan are covered better. So let me kind of just tell you, there's an order of operations that you have to look at. Number one is medications. The first thing that you need to look at as a beneficiary is to determine if you want to use Medicare or group coverage is your medication. So you need to get with a representative and let them go over your medication costs with Medicare to determine if you should even move forward. Because the truth is, if your medications aren't covered well, then you shouldn't move forward. And honestly, I would say that you should keep your group coverage. Now, the next thing that you look at in the order of operations is doctors. So with doctor costs, this is so important. If you get regular Medicare and a supplement, you have to you don't have to make sure of your doctors because everybody takes Medicare. Most people take Medicare. If they don't take Medicare, you need to keep your group coverage anyway. But 98% of doctors take Medicare. It's just extremely rare. Honestly, most doctors that don't take Medicare are like cash pay doctors, and they're very uncommon and they suck, to be honest. But private businesses can do what they want. Group coverage and Medicare. If you are you looked at your medications, and your medications, either your medications are not that big of a deal, you don't take many, they're covered by Medicare and your group plan. It's neither here nor there. If you put your medications in and your group plan is covering it way better, then just keep it. Because that's the biggest one that I see. Whenever someone's getting off of group coverage, going on to Medicare, that's my biggest concern. Are they going to pay a lot more for any sort of medications that they take? So that's the first thing. Second thing is doctors. Make sure the doctors are in the network. Again, if you choose original Medicare and a supplement, you don't have to worry about it. If you choose Medicare Advantage, you will have your representative take the doctors, put them into a system, and they will determine if your doctors are covered by Medicare Advantage. The next thing is premiums. So obviously, if your group plan is $400 a month and Medicare is $300 a month, well, saving that $100 a month is nice, right? But we don't want to do it if your medications aren't covered or if your doctors aren't covered, right? So we just have to go by this order of operations. Number one is doctors, like I said. Number one is medications. Number two is doctors. And then number three is going to be premiums. So after you look at medications and doctors and determine if you should even continue on looking into Medicare, after that, you're going to look at what? Premiums. How much is this costing you? Is it more cost efficient for me to go with Medicare or with group coverage? Most of the time, Medicare is more cost efficient. If it is, then you can continue on. That being said, you have to look at your total cost. Total premium plus cost at the doctor's office and at the pharmacist. When you have somebody like me who has done this so many times, I can tell you what you need to do. I can't tell you how many times I've told people, look, don't get Medicare. Keep your group plan. I've told them that plenty of times because I'm going to do what's best, always. But there's so many different types of situations that could come up, right? But if you're somebody who has gone through the process, doctors, medications, premium costs, and then the next thing you're looking at is out-of-pocket costs, co-pays, deductibles, max out-of-pocket, things like that. Once you look at all that, then you really are in a situation where right? You have medication costs. Are the doctors taking it? What's the premiums look like? And then what are the medical costs day to day? Once you have an idea of which one, most of the time, you're going to have a clear, concise option. It's either going to be like, obviously I need to get Medicare, or obviously I need to keep group coverage. Very uncommonly is it like borderline, But if you decide that you want to keep your group coverage, you will enroll in Part A only, and you will delay Part B. So that way you don't have to pay that premium. That Part B premium can be kind of a pain in the neck because there's no reason to pay it if you're not using your Medicare actively. You just have Part A, and it's a secondary hospital coverage for you. It's great. Part A, typically, as long as you've worked 40 quarters, you get for free, so you don't have to pay anything for it. Part B is going to cost you money either way. And if you're in a higher tax bracket, then you're going to pay more for it. So, to recap, if you're on group coverage and you're thinking about taking Medicare, you just need to obey the order of operations: medications, doctors, premiums, out-of-pocket costs.